we're going to be talking about this idea of using Chinese medicine for 7 stages of living with cancer. My emphasis is on herbal treatment, but we will also have some discussion of acupuncture. But I think if you bear with me through the herbal stuff, you should all be studying herbal medicine. It's just a given, really. But for various reasons, acupuncturists seem to be neglecting this imperative. But it might hopefully stimulate you to be a little bit interested. So, oh, they're all leaving already. Okay. Oh, well. But what we will be we're talking about acupuncture as well. Okay, talking about shooting myself in the foot. What I recommend for those of you with a more open mind is stay. If you find it's not to your liking, then go, and don't worry, I won't be offended. I do have a photographic memory for faces, and I will never speak to you again. But apart from that, don't worry about it. So let's stay. I'd like to, as I said, make it informal, and if you've got a question or if you've got a comment or anything like that, just let me know and we can talk about it. So just a little bit about me. My name is Andrew Flower. I'm an acupuncturist and herbalist. I've been practicing since 1992. I'm also a postdoctoral research fellow at Southampton University, which is completely irrelevant to what I'm going to be talking about because it's very difficult to do research, particularly with herbs, on the treatment of cancer for a number of reasons. But I have a kind of a foot in the research camp and a foot in the clinical practice camp, but predominantly I'm a practitioner. So, what we're going to do is we're going to have a little look. Have you seen Prezi before, by the way? This thing is called Prezi. It's a bit like PowerPoint, but it's a bit more jazzy than PowerPoint. For those of you who suffer from motion sickness, you're almost certainly going to be vomiting by the end of the show. So it makes sure you've got a plastic bag to hand. Okay, so woo. Okay, there we go. Okay, there's one down. So what I want to do is, we get quite jazzy when if we have to whip through the herbs, you're going to be in a terrible state. So we're going to talk about 7 stages of living with cancer, and I think this is very important, and it's as much to do with patient management and using your imagination to put yourself in the position of someone who has cancer. And we're going to look at these 7 stages: after diagnosis, before treatment, during treatment, post-treatment, maintaining good health, living with cancer, and palliative care. And we're going to think about some of the things that Chinese medicine can offer to help support a person during that process. And some of it is treatment, some of it is acupuncture, some of it is herbal, some of it is lifestyle advice, and some of it is about a reframing of the disease, which I think is really important for people. Many of you, how many people here have experience of treating people with cancer? So, oh, all of you, my goodness, so you should be giving the talk. Okay, so you know what we're talking about. Many people, I was talking to a lady in the front, many people are quite scared of working with people with cancer. My experience is that it can be really challenging and it can be very upsetting, but it's almost always uplifting in a weird kind of way, and it's very real. You know, it's a very real form of treatment, and it allows you to be as real as you can be as a person and as a practitioner. That's a challenge, but it's also a nice part of the treatment. So, close your eyes. Okay. Okay. So we're going to have a little look at cancer in Chinese medicine, a little bit of briefing, and we'll whip through these. The word Liu tumor, unfortunately, this PowerPoint thing was, because it doesn't do the Chinese characters, otherwise I'd be able to show it to you. But the word Liu appears on bones and shells from 16th through 11th century before the Common Era. So it's a very ancient reference to the idea of lumps and tumors that's there in Chinese medicine. Okay, cancer-like conditions were differentiated and described in the Su Wen, and there are examples of different types of cancerous-like conditions, like Xia-Ge, masses below the diaphragm, Shijia, uterine masses, Changliu, intestinal tumors, and Ruyan, which is the one you're probably familiar with, which is the breast rock, the breast lump. And those are well described, and the descriptions really bear a lot of resemblance to kind of modern descriptions of these diseases. They talk about well, you'll see what they talk about it. The word Aizheng, which is is the common word for cancer in Chinese hospitals, is first mentioned in the 12th century. And we haven't got a thing we can write on, but the character I contains the idea of a rock, three squares over the idea of shan, which is mountain. And the idea, if you can see from this picture here, is that as you run your hand over something like this, over a breast or you can feel this kind of protruding rock that's there. So again, there's a very old history of describing cancer and cancerous conditions. In terms of etiology and pathology, it's again a long history of looking at the emotional cause of cancer. Tumours are formed due to accumulations or violent changes brought about by anger, joy, sorrow, pensiveness, or fear. And again, Zhu Danxi says, when sorrow and anger and depression accumulate day and night, spleen qi will be dispersed and dejected, and the liver qi disrupted. In consequence, a concealed node will gradually form. Decades later, it will appear as ruyan, breast rock, and by then it is too late to be treated. So there's a notion of a long build-up, a long kind of precedence before you get the manifestation of a small tumor which can progress and can be obviously devastating to the person. So there's a few things from this which I think are already really kind of interesting. One is the emotional dimension to causes of cancer. And whilst I understand the reservations of many conventional doctors and oncologists who say that people feel that they're being blamed for the development of their own tumors if they feel angry or guilty or they haven't expressed that emotion. For me, the emotional causes of disease, the Nei Yin, is hardwired into Chinese medical thinking. We can't help but think in those kind of ways. And in my experience of working with people with cancer, it's a really important component to the treatment. And we'll see that in some of the cases that we look at. But again, you will come across, if you're dealing with oncologists, you have to be very careful about talking about these things, although patients will often volunteer this kind of information themselves. Sorry, Marianne, okay. So let's have a look at a little bit about a description of what the pathology of cancer is. The key thing for the forming of cancer is the idea of the four excesses. So stagnation of qi, often stagnation of qi is the prelude to the other stagnations, blood stasis, phlegm accumulation, and fire toxins. Now in acupuncture, it doesn't matter so much, really. You're dealing with stagnation of qi, and that if you can get the qi circulating, hopefully you can regulate a normal kind of balance in the body's dynamic. But with herbal medicine, it's really important that you actually make those differentiations. It's also associated with a deficiency. Okay, so if you're going to get the excess, you also, for the cancer to arise, you have to have a deficiency. And this is very simple. One of qi, blood, yin or yang qi, all those put together. So Chinese medicine, what I love about Chinese medicine is it starts very simple. It's very kind of simple, very basic, isn't it? Yin, yang, two things. But out of that, you get a kind of complexity of understanding and also of treatment. So this is an example of I don't know if you can see that clearly. It's not the best slide, but what happens, I think, in terms of cancer is that these four excesses are all mutually reinforcing. So qi stagnation can cause blood stagnation. Blood stagnation can cause phlegm stagnation. The whole thing, caboodle, can cook and cause the stagnation and lead to fire poison. That in turn can cause blood stasis, more phlegm, more qi stasis. So you've got a self-perpetuating positive or negative system where basically you're getting an increasing build-up of these pathogenic factors. This is difficult to unblock. This is difficult to change. You can, and there are different ideas. I think with acupuncture, you'd be looking at much more trying to, as I say, get the qi moving. But in herbal medicine, we try and address all of these four main kind of characteristics. And those things in themselves are caused by a number of different things: aging, trauma, external pathogens, emotional factors, and they in turn cause these things as well. It's a two-way process. So it's a very self-reinforcing process, pathological process of excesses being as a result of deficiencies and deficiencies being the result of excesses. Okay, so close your eyes, Marianne. Okay, so there's also, when you think about someone with people with cancer, remember you're treating a person, you're not treating a disease. Legally, you're not allowed to say you treat cancer. You are allowed to say you provide support for people living with cancer. And it's really important to remember that they are, as well as having cancer, they may also have digestive problems, mental emotional problems, asthma, or urinary tract infections, or eczema, or anything basically. But it's important to put that into your considerations when you're treating disease. Okay, so in terms of treatment for these things, so there's often considered to be two fundamental approaches. The first is to take your attack, okay, to attack the cancer. And that's using, again, in herbal medicine terms, strong draining, strong clearing herbs. Chemotherapy, I would say, is a fairly attacking, aggressive form of treatment, but it's the idea to kill the cancer cells. The other end of the spectrum is the idea of nourishing, of supporting, and the idea of building the person up, strengthening their immune system, helping their natural vitality. You know that we're all constantly producing mutated cells that could become cancerous, but our immune systems are mopping these things up. So by strengthening the immune system, the idea is you keep these, you can keep cancer in check and keep things under control. Yes, sir.
Do you have any clear ideas about an anti-cancer diet that you would recommend?
No. I do have some ideas. I mean, I think.
I see a lot of fruit up there.
Yeah, I mean, I'm not a.
Dairy as well.
I wouldn't. I think diet is a really kind of complicated issue, and it's not something I particularly want to go into now. I would say that I think sugar is fairly satanic when it comes to cancer, and if you've got cancer patients, if you can encourage them and support them to stop eating sugar, cancer cells have a preferential uptake for sugar. It's one of the ways they diagnose it with a PET scan is they use radioactive glucose, and the cancer cells just lap it up. So it's obviously a source of nourishment for cancer. So if you can control the amount of sugar, that's really important. My attitude towards diet, I think, is quite kind of Chinese. I don't think there's one diet that's right for everyone. I think diet has to be, individualized. So if someone's very hot, they can fine with cold food. If they're very deficient, they need more warming food. I think the important thing is for people to listen to their guts, literally their microbiome, food that works for them. I have a patient with, or I haven't seen him for a while, but prostate cancer who followed one of these really, very kind of radical diets, and he basically came into the clinic burping, farting, and stinking of garlic, and spent his whole, and he was really uncomfortable. He went to France for a weekend. He ate croissant and baguettes and drank coffee, and his stomach came as flat as a pancake. He was really happy, but he went back onto his burping, farting diet. My feeling is that probably wasn't doing him much good, because it's not what you eat, it's what you absorb, and what you absorb is to do with lots of things like the food that you grew up with and the food that works for you, basically. So I'm very conscious that you can make people's lives utterly miserable by restricting their diet. It's easy to say, not so easy to do, and you can create a lot of guilt and things like that. I remember when we were studying at ICOM, we were all into macroneurotics, and we used to come in and confess on Monday morning that one of us had had a scone, and it was a terrible thing. We were beaten.
But at the same time, we have to recognise that our Western diet is the basis of all sorts of ills.
Yes, I think that goes. That's a given.
Something fundamentally wrong with the way we eat.
Yeah, they attribute 35% of cancers to do with diet. I mean, I think that, whether it's too much red meat, whether it's too much sugar, whether it's, there are all kinds of carcinogens that abide. But, yeah, I mean, diet is important. But I think the general principles of Chinese medicine with diet are enough for the moment. I'm not going to talk about anti-cancer diets because that's not really what I do. There are people who do it, but it's not me. So I'll shut up about it. So this I would say is the third way. If you think about the attack and if you think about the tonification and the strengthening, I think the Tai Chi is a nice model of something that's kind of nourishing but also attacking at the same time. And I think that kind of integrated approach works for many people. You have to tailor it according to the person in front of you. You have someone's really strong and they're young and they're robust, you get the hell out of them, But if someone's quite frail and depleted, if you do that, you might make things worse. So you have to be flexible, and you have to think about these two ends of the spectrum and try and integrate them. In terms of key treatment principles, again, this is probably makes more sense for herbal medicine, but acupuncture should think about this as well. So really important in terms of cancer is the idea of fire poison. It's not a notion that acupuncturists are particularly familiar with, which is why you should also study herbal medicine, because you'll understand more about Chinese medicine. Sorry, I had to say it, slipped out. So fire poison is the idea that when you get heat that intensifies, fire poison gives it that extra dimension. The disease becomes more recalcitrant, more active, more widespread. Fire poison adds a kind of an extra degree of activity to it. So again, traditionally, probably in acupuncture, it's the kind of thing that you get a nice boil, and that's where you'd be using kind of needles to kind of to burst boils, to reduce that kind of really nasty kind of toxic swelling, which is in a way what solid tumours are. So eliminating fire poison is something you should be thinking about in terms of your treatment. We have lots of herbs that do that. as well. Moving the blood and circulating the qi. This is really, obviously really important because you're trying to break down that stagnation. Resolving phlegm. Often tumours, benign tumours are often quite phlegm-based, and there's often phlegm within tumours. Remember the saying that, for stubborn diseases, treat phlegm. Phlegm is a really important component to many types of cancer. And then you have to support the zheng qi, the upright qi, which again you can do with acupuncture, you can do with herbs. Address individual pathology. Make sure that you treat every person as an individual. And this is for herbs again, look at some empirical and anti-cancer herbs. I don't know empirical anti-cancer points. I don't think acupuncture works in that way, but there are herbs that do, and that's worth thinking about. You're not going to be interested in move blood herbs, are you? Should I just talk to you a little bit about it, just to whet your appetite? So when you're doing herbal medicine, it's really important to look at the primary action, the secondary action, and the empirical use. These are commonly used herbs that are used for herbal medicine, the treatment of cancer. So you'll know some of these. Turmeric is the third one, jianhuang. Salvia, danshen, is a really quite commonly used herb. Ruxiang is frankincense. Yeah? Frankincense is a really good herb for cerebral edema that's related to brain cancers. And in fact, it was an orphan drug. It was a drug that was allowed, doctors could prescribe without having a licensing. Erju and sanleng, these are very important. These are powerful herbs to break the blood. And this is cockroach here, that's leech. Wonderful herbs. We get to take all these wonderful things. Think of what you're missing when you're not studying herbal medicine. Sorry, it slipped out again. So, sanqi is a herb that you might know. Sanqi is called noto ginseng. Sanqi, have you heard of a powder called Yunnan Bai Yao? Yeah, Yunnan Bai Yao was basically used, is a very old treatment that the Chinese tortured out of the people who invented it, bless them. And it was used a lot in the Vietnam War. And the Americans found that a lot of the Viet Cong, they found all these little vials of this powder stuff that was used. And sanqi is an amazing herb because not only does it stop bleeding, but it also moves the blood. So it's really the herb par excellence for wounds and for traumas. It's good for gynecological problems. But it's also got an anti-cancer action as well. And modern research has shown that it's cytotoxic. It can kill cancer cells. It promotes apoptosis, so it encourages cancer cell suicide. It's anti-proliferative. But it also has ginsenosides in it, like ginseng, which enhance the immune system. So it's a really, what I call an SHH. This is called a shit-hot herb. Okay? That's sanqi. It's a really lovely herb to use. There are other herbs, again, that we use to resolve phlegm. Will you know any of these? Gleditsia, you might know. Kumbu and Haidao is the seaweeds at the bottom there. These are the two seaweeds that they're salty, and salty herbs tend to soften hardness. And Kumbu and Haidao, I don't use them that often, but they can be used for things like breast cancer. A very nice herb is Shakutsao, which grows in your garden. If you come and see us in the stall today or tomorrow, Shakutsao is self-heal. You know the Prunella vulgaris, the little purple flower that grows in your lawn. It's fantastic herb. It's everywhere around you. It's good for clearing heat and toxins, and particularly working on the liver. And it quells fine, also resolves phlegm. And it's been shown to have a nice anti-estrogenic effect, so it's good for breast cancer. There's been some really good research from a guy called Yair Mamon in Israel using it for breast cancer, and with some really nice results. But it also modifies the microenvironment, inhibits growth-promoting signals, and has an anti-angiogenic factor. God knows what factos means, but never mind. And it also promotes apoptosis. And I know this because I read it in a journal, so it must be true. Okay, remember, everything you read in journals is true. Peer-reviewed, Journal of Ethnopharmacology, not to be sniffed at. Okay, so fire poison herbs. Again, these are these really important herbs. These are things like honeysuckle, forsythia, that you'll know. Dandelion, yeah, really kind of good, commonly used herbs. And there's a spectrum of those, from the lightweight ones to the more heavy-duty ones. The most commonly used herbs are things like called hediotis, Baihuo Shishitsao, and Banjilian, which there's a lot of research about them. And they're shown to have they promote apoptosis, they're cytotoxic, and they also inhibit this cell cycle, and they inhibit cell proliferation. But they also shown to have an immune-enhancing effect as well. So they're doing two things. They're doing the Tai Chi. They're getting the cancer cells, but they're also stimulating an immune function. So these kind of things, I won't go into this because this is not really your cup of tea. Invigorate Qi herbs. A lot of you will know these things as well. Astragalus, have you heard of that? Astragalus, you probably use it a lot with your patients. The Shen family, which is ginseng, everything from ginseng to the colder herbs, Kushen. Lingzhi, which is one of the medicinal mushrooms. You should probably, if you're treating cancer and you're not using herbs, you should find out about the medicinal mushrooms. Lingzhi, Yunzhi, there's a variety of different ones, and I think Balance do a nice medicinal mushroom range that is really good for people taking chemotherapy, but also long-term. These mushrooms are shown to have an anti-cancer effect, but also a very strong immune-enhancing effect, and they're really good. So other herbs that you can use, but Lingzhi is the one. It's a lovely herb. It's one of those herbs that costs a fortune, and it's just a great herb. It's sweet, which means sweet taste is nourishing. It enters the heart, so it's got a heart-calming effect, and it also enters the liver and the lung. It moves the qi in the blood, and it calms the shen. And there's research to show that it's immune-regulating. Again, it promotes apoptosis, this cell suicide. And there's some equivocal research saying it's anti-angiogenic, i.e. it stops the development of blood vessels that the cancer cells produce to allow themselves to survive. Okay. Okay. Is everyone okay? Secret information. Yeah, what I'll do is I'll put it online. You can download it, so you can access the whole thing.
Do you use them alongside chemo?
Yes, we'll talk about that. But I'm happy to treat alongside chemotherapy. A lot of people are very nervous about using herbs with drugs. A lot of new graduates for herbal medicine really, oh my God, someone's on antibiotics, can I use the herbs? My experience is yes. I use herbs with chemotherapy. I use herbs with strong drugs. I definitely use herbs with antibiotics. I'm treating millions of recurrent urinary tract infections at the moment, and people have been on one of my patients has been on antibiotics every day for 9 years. So the idea is to get off the antibiotics, and you can use herbs to do that. You can use herbs with steroids to mitigate the side effects. My experience is that herbs enhance the effect of most drug treatments if you're treating the person correctly.
Do their consultants know that?
Sometimes they know. I'm rubbish at communicating with conventional doctors because I've had so many patients who've told their doctors that they're doing this, and the doctor says, well, stop that. And so I send the doctor some information, some clinical trials, a systematic review, saying, actually, you know what? There's some evidence to show that if you take Chinese herbs while you're having chemotherapy for breast cancer, you get less neutropenia, less anemia, and you get a better outcome, and your quality of life improves. And the consultant says, stop taking the herbs. It's not rational. It's not a rational debate, this. It's a fundamentalist problem. And it's very rare to find a good oncologist who I think actually supports the treatment. We'll talk about some cases in a wee while. So the first thing is, we're going to talk about some cases now. So just give you 7 different cases that have come into my clinic. So after diagnosis, you have to use your imagination. People talk about the fact that there's before and after a cancer diagnosis, and they can divide their life almost into those 2 stages, because after you've had a diagnosis of cancer, nothing is ever the same. Okay, you're no longer immortal. Okay, there's the prospect of illness and a poor outcome that suddenly becomes vivid and very real to you. And people are often shocked, traumatized. They might be in denial. There might be huge amounts of fear. There's lots of uncertainty. What does this mean? There's often lots of anger, and sometimes just plain depression. Sometimes it's just like someone's had a big kick in the nuts, and oh my God, my life falls apart. And stuff can come up from the past, lack of self-worth, feelings of anger and feeling of beating yourself up for all kinds of reasons. There's a huge spectrum of different responses. And what can we do with Chinese medicine? Well, what we do with Chinese medicine, we think we do a lot with our acupuncture and with our herbs. Actually, we do as much with our relationship with our patients and the language we use as we do with our specific treatments. I know this because I'm one of the few people in the room who's probably ever delivered a placebo treatment to anyone. And to my absolute horror, I got some superb results with endometriosis using a placebo. And, it's humbling to do that as a practitioner, because what you think, we need to use this particular acupuncture point or this particular herb. They were on vegetable juice, and some people scoring 10 out of 10 on a visual analog scale for pain went down to 0 out of 10 within 2 weeks and stayed at 0 out of 10, just taking the vegetable juice. That was what was known as the placebo effect, but really it's about initiating a self-healing process. It's what Sam was talking about today, about restoring a kind of effective kind of homeostasis within a person. But these self-healing responses, it's as much to do with you as your needles, and about the relationship and about the language that you use to describe illness. So with Chinese medicine, can you read that okay? You can see that. I can make it even bigger. See? It's good, isn't it? Okay, so a reframing of the disease. So we will see a case, actually I don't know if we will see a case, but a woman came in to me, a 26-year-old woman with Hodgkin's lymphoma, and she had a thumping great big tumour in her mediastinum there, and is obviously very serious. It's one of the cancers that responds well to chemotherapy, although she's had a really rocky ride. No one had talked to her about her emotional life or her past or history, and I find this really common with all kinds of conditions, that conventional medicine just doesn't see the emotional dimension to illness, whereas Chinese medicine, as I said, is hardwired. So I talked to her about her condition, about the fact that she's got, this area of the heart is affected, and she spontaneously starts telling me the fact that when she grew up as a child, her father left when she was 8 years old. She always felt this sense of emptiness in her chest. Then she felt that her mother remarried to a fundamentalist, someone who was very religious, and she was always seen as sinful, and she felt that she was the dark sheep of the family, and she always felt disconnected in her heart. She had a big emptiness in her chest. And I'm not saying without being simplistic and trite, I think that tumour came as a result of that emptiness over many, many years of emotional upset. And for her, that makes sense. Yeah, you've got to be careful. You don't want to project your own interpretation. You've got to be quite tentative, and you've got to almost negotiate that understanding with someone. But for her, that made a lot of sense. And all of a sudden, it wasn't just a kind of a random genetic mutation. It was about her life, and she's made extraordinary changes to her life, I think, as part of the way of remedying that. By the way, if I forget to mention it, a book called Radical Remission by Kelly Turner, you should all read. It's good, isn't it? It's a good book, very good book. Radical Remission by Kelly Turner. If you're going to treat people with cancer, it's a good book. And what she did is she was a psychologist working in, I think it was in Mount Sinai Hospital in America. And she was counseling patients, and she came across a case which was supposedly what they call spontaneous remission. And she thought, oh, this is really interesting. So she started researching it, and she suddenly found out to her horror that there were loads of cases of people with stage 4 cancer who suddenly got better, who should have died but didn't. And so she did, many conventional medics know this as well, but she did the obvious thing. She went and talked to them. She interviewed 100 or so patients, and she managed to distill some of the key features that they all did. And they all did different things. Some of them emphasized diet, some of them emphasized exercise, some of them said acupuncture. But there were 9 common things that came up again and again. And some of them were about physical health, about emotional health, about social health, and about spiritual health. It's a really nice book because it's inspiring. It's a really good book to give to your patients as well, because it breaks out from the medical model. And that's what they need. Even if the treatment doesn't necessarily work, it still makes sense of a treatment in a way that I think is really important.
Sorry, could you say the name again?
It's called Radical Remission. Kelly Turner. Kelly Turner. She's a bit annoyingly American, but she's not that bad. Sorry for the Americans in the audience. Okay, so what we can do with Chinese medicine is we can reframe the disease. So it's not just this random mutation. It means something more meaningful, something more profound. And that is in our medicine. I gave you the quotes at the beginning. 1,000 years ago, they were talking about the emotional causes of cancer. That makes sense. Chinese medicine is just so brilliant. As a slight diversion, I treat with urinary tract infections. I've translated some texts of like 1,600 years old, and they said emotional stress, poor diet, and fatigue can cause Lyme diseases and causes provide a kind of background to these urinary tract infections and burning urination. I see that every day in clinic. People come in they're stressed out of their brains, they eat poor diet, they've got dampness in their body, they've got chi stagnation that causes heat, damp heat in the bladder, UTI, boom. 1,400 years ago, described by a Chinese doctor, or 1,600 years, whatever it was. So our medicine is superb in that way, and it's really good. And I think that there is a contrast between the conventional and the holistic treatment options that we offer as a result of that. So for us, lifestyle is really important. It's really important people get enough sleep. Pete Dedman's book, which you should all buy, I have shares, Nourishing Life. It's brilliant. It's brilliant. It just goes about the common wisdom that we were trained in, just to eat well, to how you eat, what you eat, so not eating too much late at night, being moderate in these things, getting enough sleep. Most people in life would feel better if they got more sleep, did more exercise, ate well, and drank less alcohol. I speak from personal experience. I'm doing all those things badly now, and I feel awful. So I know that when I stop, I'll feel great. So we've got all these options, and we also re-empower a person. This is really important. One of the things that happens, as I said, is when you become a patient, And this is whether it's cancer or anything. You suddenly become a patient. You suddenly become disempowered. Bless you. And that is really important for a person to feel that they have some power and they have some kind of element of control. I think that's a really important thing. And we offer counselling to talk to people. So this first case, ready, Marion? Close your eyes. Oh, goodness. This first case is a 53-year-old osteopath. So again, as soon as you know she's an osteopath, she's committed to the idea of complementary medicine. She's developed a cancer. So she's got newly diagnosed breast cancer. She's had some surgical excision, but she's waiting to find out about lymph node treatments and the need for chemotherapy and radiotherapy. She, in fact, had those treatments as well. She had no appetite, insomnia, feels understandably anxious. Tongue is slightly mauve, so red side, so there's some qi and some blood stasis. Thin yellow coat, so I would see that as a sign of heat. I look at the sublingual veins, the veins under the tongue. It's quite useful to develop a scoring mechanism for them. So I score them from 1 to 5, where 1 is pretty minimal and 5 is these really long, deep purple congested veins. And it allows you to see whether those things have changed. Yeah, and also hers were pretty severe, so she had a lot of blood stasis, and her pulse was wiry. So the treatment principles, again, I think it's really important to be clear about that. So we move liver qi, we move blood stasis, we resolve phlegm, eliminate phytoxin. These are the 4 excesses, the 4 stagnations. We invigorated the jing qi, we calmed the mind, and we helped try to promote sleep. Acupuncture points, my goodness. Not for very long, don't worry. We did that. And next on the herb, my acupuncture is quite simple. And, there's a lot of elaborate theories about acupuncture. I find the simple seems to work reasonably well, to be honest with you. So I see it as the main train stations that I use. If you think about, as a map of all the train stations, I don't use the kind of, the Buxted. I use Victoria, Waterloo, York, various other things like that. These kind of main points that I think are kind of fairly well established that, for me, seem to have an effect. Acupuncture is a really complex intervention as well. The point specificity is interesting. You're definitely plugging into a network. And, for me, acupuncture is a mystery that I do rather than contemplate massively, I have to say, probably to my detriment, but it seems to work. So these treatments here, gallbladder 34, fairly obviously to move the liver qi. Stomach 40 resolves phlegm, and the stomach channel goes through the breast. Spleen 6 with everyone, really. Spleen 6 to nourish the yin and the blood, and also to calm the mind. And liver 3, which, despite what some of my colleagues say, I think is a really nice qi moving point and is also a good calming point. Pericardium 6 obviously helps to move qi and blood in the chest, but it's also very calming. And yin tang. I think yin tang should be applied at birth and just left there. All right, because we all need yin tang. And even the Goons wrote a song about it. yin tang, yin tang, yin tang. You know what I mean? Bilateral yin tang. Yes, most of my treatment is bilateral, unless I'm doing the extra meridians. If I'm feeling smart, or risky.
Do you pay attention to needle technique?
Yes. I do, but I have theories about that which you won't like to hear. I mean, my first teacher was a Chinese guy. He was a Guangzhou Ren. He was Cantonese. And when he did needle technique, he really did needle technique. It wasn't kind of like, twist a little bit to the left, a little bit to the right, shake it a little bit about. It was like, and you really felt this thing going off. And it was like, and, you could really feel things moving around. My feeling is that there's lots of layers to this question, isn't it? One is your intention. I think the intention is really important. I recommend you try this when you're in a good state and you've got a supportive patient. Is John Tyndall wrote about this, and it really can change the way I practice. Put a needle in, calm yourself down, try and get the qi sensation, so elicit the qi, and then with your intention, try and move that qi to where you want it to go. And to my amazement, on a good day, if you try and intend the qi, you can't force it. You've got to kind of ask it nicely. Try to get qi to move down the large intestine meridian, it will, and if you can move it, it goes up the large intestine. Now, there's no explanation for that in conventional medicine, as far as I'm aware. It's one of the mysteries of acupuncture. One of the reasons I love acupuncture is for that. So that's important. So intention's really important with needle technique for me. For me, the key thing is to elicit qi, to get a sensation of qi, and then I tend to rely on the homeostasis of the body. So if it's strong and moves around, I think we're doing something dispersing. If the point feels empty when you're needling it, then sometimes you have to kind of gather the qi and build the qi up at that point. And I'm quite big in terms of whether you're pushing the qi in or taking the qi out in terms of needling. That's as much as I do in terms of needle technique. So I'm sure there's many more elaborate things as that, but I don't think it's simple needle technique. I think it's kind of a complex art. A lot of qigong is really required, I think, to do acupuncture really well. All you acupuncturists who are not studying herbal medicine, you naughty people, should be doing qigong furiously. So that's your only excuse for not doing herbs. Speaking of which, these are the herbs that we used here. So when you're using herbal medicine, again, we tend to use it in a modular way. So the first herbs, that's peony, and that's a type of turmeric. The herbs, so the first lot of herbs are there to move the liver qi and soften the liver and to move liver blood. So again, one of the reasons I like herbal medicine is because you're doing lots of things there. You're not just moving liver qi. So if I'm going to move liver qi with acupuncture, I use gallbladder 34, liver 3, pericardium 6. There's a nice combination for me that gets the qi moving and circulating. But with herbs, chai hu is a herb that moves the liver qi, circulates the qi. Bai Shao is a herb that softens the liver. It nourishes the blood and the yin of the liver. And the liver's like a sponge, isn't it? So if it gets all dry and irritable, it gets all... Ugh. And if you soften that sponge, it becomes more pliable and the qi moves. And Yu Jin moves the blood. So you're looking at the problem from multi-dimensions. Aye.
Sorry, it was a question about the acupuncture, actually.
Oh, don't ask me about that.
Do you have any concern about creating movement through an area with a tumour?
No. No, I mean, obviously, I'm not going to needle a tumour itself, but I think that you're thinking about metastases, basically.
Yeah, I mean, I've heard it, I've heard that said.
I've heard that said about things like massage as well. People won't massage people with cancer because they're frightened of spreading it. My experience often with people at end-stage massage, people in hospices and things like that, they love massage. You know, to be touched in a therapeutic way is a really wonderful thing. And I think that we sometimes give one of the ways of bigging ourselves up is to talk about side effects. You know, we're so effective, so we can have so many side effects because that's why we're so effective. I don't think it's so easy to create metastases by moving the qi in that way. I can't, it's a very difficult thing to prove one way or the other, but you know, whilst I wouldn't needle a tumour directly, I have no qualms about doing pericardium 6 on this woman here, which would move the qi in the chest. I think that will enhance the treatment as well. But it's a good question. You know, you have to, yeah, I don't think that's a problem. And I wouldn't be too nervous about it. Yeah. Oh, these acupuncturists are already switching off now. I can see them walking out the door. You can use, these are actually powdered herbs that you can just add hot water to. It's very easy to take. Don't worry about the dose. I don't want to bore the acupuncturists too much. And they're in the majority, and they'll beat us up if we carry on too much. But these herbs here are used in blocks. So the first lot is to move liver qi. The second lot is to move phlegm. I want to just focus on one of those in a minute. This is dandelion. This is astragalus, and that's Ganoderma, the mushroom that we're talking about. This is Meiguihua, Hua, which is rose petals. Yes. Come and study on our course. Rose petals. And this is Swanzaren, which is astringes the liver, nourishes the liver yin. It's good for promoting sleep. And Gansao is licorice, which is good for harmonizing formula. I just want to just very briefly introduce you to a herb which you know, because those of you who have baths. How many of you have baths? Okay, just checking. Because you know the loofah that you use in the bath? It's actually a Chinese herb. So you're using a Chinese herb. You're a herbalist even though you don't know it. Okay? It's a sweet and neutral, and it enters the stomach, the liver, and the lung. So Sugualo, and its actions is to kind of clear toxins and to resolve phlegm and to move the blood. So you can see this herb is a nice herb to use for clearing some of those excesses that we talked about. It also, if you look at it, the kind of lattice-like structure of loofah, the Sugualo, it looks like channels and collaterals. So it's got a kind of correspondence, medicinal correspondence to it. It looks like those channels and collaterals, and it's particularly suited to opening the channels and collaterals, particularly in the breast. It's not a particularly strong herb. It's a relatively minor herb, mild herb, but it's a herb that's good to use for breast cancer and to open and get that circulation going. And going back to Danny's point, people are really concerned about, for example, if they use chemotherapy or radiotherapy, using herbs that move the qi in the blood. That's one of the functions of herbal medicine in these treatments, because one of the problems with chemotherapy and radiotherapy is that the free radicals from radiotherapy don't actually get into the cancer because it's poorly vascularized, or the chemotherapy doesn't get in there. So if you can provide herbs that promote microcirculation and encourage the delivery of those toxic free radicals or toxic chemicals, you're actually enhancing the effect of chemotherapy. What's that? Well, I'm just saying that if you're giving treatment during chemotherapy and radiotherapy, people are very worried about moving things. So Danny's question about whether you can enhance metastases, the spread of the cancer, by getting things moving. In chemotherapy and radiotherapy, one of the aims of particularly herbal treatment is to encourage the microcirculation to the tumour that allows the delivery of chemotherapy and also allows the delivery of free radicals from radiotherapy, which kill the cancer cells. And so there are herbs, for example, Jushui Teng, which both support the blood and promote the circulation. San Chi, the one I mentioned, the one that's used for gunshot wounds, is also a really good herb for getting things moving and opening up those small blood vessels. It's used a lot for angina and those kind of things. Again, another wonderful range of treatments that you can use when you study herbs. Sorry, you're going to get thoroughly sick of this soon. Okay, yes.
If you promote circulation to the tumour, does it not also give it the opportunity for growth?
Well, that's what Dan is saying. That's what Dan is saying. There is but you're not just doing that, are you? So that's why, again, you have to have a complex treatment. You're not just moving the chi in the blood. You're also including herbs that clear fire poison, that clear phlegm, and that have an anti-cancer action. So the idea is you open this area up to something, to the light of treatment, whether it's conventional treatment or herbal treatment. But you've got to be, you have to have a balanced treatment when you do it. The second stage here is before treatment. And again, there's a lot of emotional responses that people have. Crikey, when do we finish? 6? You're going to be bored out of your brains by then, but never mind. So there's a lot of things like fear. There's a lot of resistance to treatment. I've treated a lot of people. We have a selected sample of people, don't we? Someone who's, for example, been a yoga teacher all their life, has looked after their diet beautifully, has never had any drugs or any, and suddenly she's faced with a regime of chemotherapy. I would find that really tough. I mean, I think I last had antibiotics about 30 years ago, and I've had about 5 Nurofen since then. Someone said to me, "You can have chemotherapy and all my hair might fall out." I would be in trouble, do you know what I mean? But it's a terrible thing to do. You look after yourselves, and suddenly you've got this toxic thing that's going to make you anemic, that's going to make you feel like shit. You've got to, that's really difficult. So a lot of people come and see you will be quite resistant. They'll feel very disempowered. They feel that a lot of the principles that they base their life on will have to be disregarded. And they've broken their integrity. And that's really important. Their sense of their own personal integrity might be lost. Many people, it's relief. Finally, I get to actually have some treatment and get rid of this bloody thing. So it's varied. Key thing is to listen, isn't it? That's what we have to do as best as we can, is to listen, to give a person a space. Try not to project your expectations onto someone, but to listen. I think it's an absolutely knackering thing to do. I don't know how you guys think about it, but I find listening hard work. Really active listening is a tough thing to do, but I think it's what makes the difference between a good practitioner and a bad practitioner. More than needle technique, more than anything, do you listen to a person? Do you observe? Do you see? And do you give them the space to be themselves as best as you can? I think that's really important. It's what I always say if I sometimes teach the medical students and try and corrupt them, is that I always say one of the great strengths of Western medicine is their diagnostic methods, the scans and the blood tests. And I also say one of the great weaknesses, probably the greatest weakness of Western medicine, is their diagnostic methods, because they're too busy looking at them rather than looking at the patient. And they don't see. They just don't see. They don't have the... I mean, some do. Good doctors do. But I think that's, again, a real strength that we have. And our medicine encourages it. We're looking, we're smelling, we're listening, we're doing all kinds of things. So that's really important.
But in the listening, you're listening to different levels of tones in the voice.
Not really. But I think we do that intuitively. You can hear if someone... we do that intuitively. We're extraordinarily good at voice tones and facial expressions and, body language. We pick those things up. That's human beings are hardwired to do that. I think the key thing is to try and just be as calm and give as much space as you can, and try not to project. Try and see without preconceptions as best you can, and then you see more clearly. I think It's not easy, but I think the active listening is really at the heart of being a good practitioner, I think. Okay, so case number 2. This is an interesting case, and we'll see her again later on. This is a 49-year-old woman with stage 4 endometrial cancer. She's a really lovely woman. She's had a hysterectomy. She's got a lot of pain still in the sacrum, down the gallbladder channel of the leg, and going into the groin. She's about to start palliative chemotherapy in 2 weeks' time. Tongue is pale, swollen, red dots at the side, yellow fur. Sublingual veins are quite congested, and the pulse is wiry, and the liver and kidney is empty. So the diagnosis is, again, qi blood, phlegm, and fire toxin, and the underlying zheng qi deficiency. And what we're trying to do with the treatment is to invigorate the qi, nourish the blood, move the blood, and reduce pain, and to clear fire poison.
Palliative chemo sounds like a contradiction.
No, because it's basically shrinking it. They say it's not going to cure it, but they're shrinking it to stop the pain. So yeah, they do that quite a lot. But she's got stage 4 cancer. The hopes are really pretty poor. So these are the herbs we gave her, and we gave her these before and during the chemotherapy. So here we're using more tonic herbs. Huang Qi and Dang Gui is called Huang Qi, Dang Gui Bu Shui Tang. Dang Gui is Angelica. You know this Angelica, you know, the Dang Gui, yeah? And together with Huang Qi, it's used to nourish the blood. Interestingly, that ratio of 5:1 is one which is been recently found from a research point of view to provide the best reproduction of red blood cells. If you use 1:1, it doesn't work so well. 2:1 doesn't. When you get to 5:1, it's suddenly a kind of synergy or a magic happens. This is from conventional research, modern research. They find it becomes the most productive in terms of red blood cells. Using a variety of other herbs, you've got your Lingzhou in there again to nourish the qi, nourish the yin. Nugenzo is privet. You've got other herbs there. Sha Ku Cao is the herb that we looked at for phlegm, again as a clear fire poison herb and to resolve tumours. And we've got some herbs here to move the blood, to support chemotherapy, but also to help with some of the pain. And these herbs here is dandelion, that's the hediotis I talked about, and that's one of the shens there to clear heat and to help in the anti-cancer action. So we're supporting the treatment by helping to protect the zheng qi while she's having chemotherapy, but we're also helping to attack the cancer. So hopefully we're having a synergistic effect with the chemotherapy. Yeah? Do you want to know what happens? Yeah. I'm not going to tell you yet. Keep you on your toes. Okay, acupuncture, actually, to be honest with you, for her, I didn't give her acupuncture until quite far through this process, but these are the kind of points that I would have used. Again, I apologize for the simplicity. If the pain here had carried on, I would have used stomach 29. But again, I use a variety of fairly standard points that probably don't need that much explanation to you guys. Fairly simple. But actually with her, one of these people had a very wonderful qi sensation. These people who suddenly feel all the points linking up, and they get this circulation going on, and think, oh, what the F is going on here? And, you know, I just trust the body in a way to realign itself in that way. She does a lot of qigong, and that introduces me to another aspect of the thing, is that one of the things that stops people from treating cancer is the feeling that it's all up to you, okay? It's on your shoulders. It's not. You're a piece in this person's puzzle, and you're only a piece in that person's puzzle. They've got conventional treatment. She does a lot of other things. She gave up her job, really important. She had a stressful job. She does a lot of qigong, a lot of meditation, and she's radically changed her life, as well as having chemotherapy and having treatment with me. So you're a piece in that puzzle, and it's important to remember that, because it's humbling, but it also frees you up. Yep.
If someone came to you and said they didn't want to have chemo,
Good question.
how do you deal with that?
Okay, I've experimented with this over the years. I've had a number of people who've come to me and said, I don't want to have chemotherapy. I want just to treat the cancer with natural medicine and with herbal medicine. And I said, okay, we'll give it a window of time. We'll give you, say, 3 months. Let's see if we can shrink the tumor. I haven't shrunk the tumor. It's very difficult to shrink a tumor, in my experience. A few episodes where I've seen some stuff in China, but even in China, in big hospitals, I'm not saying it's impossible, and I know people have done it, and it depends to some extent on the tumor. I think some of the lymphomas, for example, are easier to treat than some of the more, the solid carcinomas. But it's difficult to treat. So I'm really conscious of our responsibility, and maybe it's supporting people to make a decision to have surgery in particular. I think surgery is a very useful treatment for cancer. Chemotherapy I'm more circumspect about, But in certain instances where there's an evidence base for it, you support people during the chemotherapy. And there's a whole load of new chemotherapy drugs, the monoclonal antibodies and stuff like the targeted therapies, which I think are really exciting and really good. And I think, again, herbs can work quite well with them.
So if someone's doctor's saying, you must have this, take chemotherapy, would you say, okay, so support it with herbs?
I'd say it's up to that person. You know, I would say, I'd be honest about it. You know, I'd say, look, this is what, I don't think the herbs, I used to work in HIV and all that stuff, and I just said, I don't think herbs are going to cure you of HIV. They might help. I'll say the same about, I'll tell them what I think, basically, which is that, you know, the herbs can help with cancer. I think often treating cancer is a bit like trying to turn a supertanker. You know, one of these boats that you think, oh, I'm off the wrong course, turn the steering wheel, nothing happens for 4 miles. Okay, cancer is a deeply embedded disease, and sometimes you need really radical, unpleasant treatment to turn the ship round. Once the ship has turned round, I think there's a lot that you can do. And you can help turn the ship round, but herbs are not as strong as chemotherapy drugs. They're not as toxic either. Generally, they're not. Not at the dose that I use them, and I use them at quite a big dose. Some people are using 10 times what I use, and they're using them as drugs. Acupuncture is not as strong as chemotherapy or surgery. So sometimes you need a radical intervention, and you need to support a person during that. I've got a patient at the moment who came and saw me on Friday who's got early stages of cancer, and she doesn't want to have any chemotherapy. So I'm going to treat her if she wants me to, but I've told her that if I feel things are out of control, I'm going to really strongly recommend that she has conventional treatment.
I just want to ask quickly, because I need to know. You said with this case that you only started to treat her when she was terminal. So is this in the hospice environment?
No, she's in the community. I don't work in a hospice. It's just in the clinic. She trundled along. You know, if you get, word of mouth gets around and people look for treatment, and it's really important that you go through good training and you become familiar with the best treatment you can offer. Go on.
What's your view of people using Moxa on the back shoe points?
Friedrich Stabler's treatment for chemotherapy. I don't do that, but I think it's a great idea. I haven't got any clinical experience of using it, but I've talked to him about it and I've read his paper about it, and it seemed to be really helpful in terms of preventing. Do you use it? Have you used that?
I do. Yeah.
And good results? Okay. Less neutropenia, less anemia. Okay. Well, that's a good tip. You know this one. The idea you identify what? 6 flowers. Oh. So what are the points you use? Okay, so then, and you mox them, and you teach the patient how to go home and mox them. Partner.
That's the bit that's difficult to achieve, but I certainly get them to come and see someone.
Okay, I think that's a really nice example. Acupuncture is used a lot during chemotherapy, both to alleviate things like nausea. It's one of the big successes of acupuncture. You know, pericardium 6 for nausea during chemotherapy is well kind of tried and tested. But there's also this other protocol that Friedrich developed on moxing back shoe points, which I think, again, is a really nice thing. It also empowers the partner, you know, that the partner can do something to help rather than just standing by, just watching. Go on. Yeah, there's always the exceptions, and there's always you have to adapt. But it's a treatment that you can use. Yeah.
It's also very telling about the relationship between the patient and their partner.
Oh my God. Good luck. Good luck. Okay, so this is during treatment. So we've moved on to a stage 3 during treatment. This person's having treatment, and again, there's all these dreadful side effects. I mean, you know, there's no question about it. They will look at chemotherapy in 50, 100 years' time as we look on bloodletting, you know, now, which in Chinese medicine, bloodletting's got a nice role to it, but they used it for bloody everyone and took huge amounts of blood rather than the small amounts that we do. It's a brutal treatment often, and it leads to these common things like fatigue, pain, discomfort, massive side effects, whether it's hand-foot syndrome, where you can hardly hold anything because your hands are all red and the skin peels off your feet, diarrhea, but also psychologically it can affect your clarity of mind. They call it chemo head. It can cause, you know, a lot of anger and depression and all these kind of things. So you're presented with quite a kind of complex presentation there. And all I would say to you is treat the person, look at the person, try and understand what's going on pathologically in terms of your Chinese medicine processes, and treat that person there. So this person here that I treated was this is an example of a 44-year-old man with advanced bowel cancer, metastases all over the place, so it's stage 4 cancer. He can't have surgery. He's having chemotherapy, so he's having one of the MABs, the monoclonal antibodies treatments, which is a radical treatment. He's got terrible side effects. He's a soldier, so I kind of tap into his warrior nature. I send him off to Pete Dedman to do some Qigong, because he's a warrior. Side effects of fatigue, he's neutropenic. He's got this terrible rash all over him, this pussy rash all over his whole body, and he's depressed. He's also, his wife's about to give birth to their first child. And he's told that it's very unlikely he'll live to see the birth of the child. I'm happy to say that the child is now 1.5 years old, and the man's still going strong. And he did well with his chemotherapy. He did it very well with his chemotherapy and a mixture of acupuncture. This guy liked acupuncture more than herbs. I tried to dissuade him, but he couldn't help himself. And he took both, but he did really well during his chemotherapy, better than you would expect, although this treatment is one of the positive treatments. But he's done much better, and he was able to, in the end, he found a surgeon who was able to remove some of the tumours. He just had an operation to remove the tumour. Last time I saw him was a week ago. He looked really good, but he's got some pains in his abdomen, which are a bit worrying, but we'll see how he goes. But he's survived well longer than he should have done, and it's really good. His symptoms relate to damp heat, toxic heat, liver qi stagnation, and yin deficiency. This is what I'm saying about diagnose. And these are the communal garden acupuncture points that I use. So stomach 36 obviously is a great point for regulating the intestines. His big thing was he got constipated, and he used to measure his improvement or his status by the diameter of his stool. So when he had these really pipe stem stools, he felt that the tumour in his colon, which was still there, was really kind of like closing off the colon and was really blocking things. And if he had a good bowel movement, then he was really happy. And stomach 36, again, this is if you don't get boborygmi, with stomach 36, in my experience, you're not doing it right. Sorry I had to say it. It causes peristalsis in the gut, and you almost always, whenever you do stomach 36, if you get qi, the person's peristalsis starts. And it's a great treatment with things like large intestine 11, which is good for clearing heat and also good for moving the bowels. These points here are to strengthen the middle jiao, clear damp heat, circulate the qi, the 4 gates, again, really nice, important points. Stomach 25, some local points to help with going to Danny's point here. He's got a tumour there, but he's also got a lot of pain there, and he's also got constipation. So I wasn't too shy to do stomach 25, and then yin tang do 20 with everyone. Totally undiscriminating, I have to say. So the herbal point, as you can see, it's a monster prescription. So again, the first part of the prescription is to nourish the qi and the yin to help support him. And then the second part is the herbs to circulate the blood to try and improve the effectiveness of the chemotherapy. And then there's some strong herbs here to clear fire poison. Qing Hao, do anyone know what Qing Hao is? It's not wormwood. It's Artemisia annua. It's artemisinin, the anti-malarial drug that they get. There's now the kind of #1 treatment for malaria in the world that comes from Qing Hao. It's an artemisia plant. There's a quick aside, by the way, just very quickly. You use moxa. You've ever heard of smudging in the American Indians? You use smudging, and they use sagebush for that. Do you know that sagebush isn't sage? It's actually artemisia. Did you know that artemisia is used by shamans throughout the whole northern hemisphere to ward off evil spirits? And did you know that the oldest character for medicine in Chinese medicine, the Yi, doesn't consist of the wine thing? The oldest character for medicine consists of a shaman shooting an arrow in the air and shamans dancing around the drum. So you using moxa now connects you with your shamanic heritage. A herb, moxa. That's not artemisia, this artemisia, it's a different one. I have no forgiveness there.
This list of herbs,
Yes.
are they all like kind of mixed together?
Yes. Yes, they all mix together. So this is a complex formula, and it's a big formula, and several herbalists would go, oh my God, that's overdosing, but it seems to work, and that's the way I do things. And you can see there's a combination of things. So these clear fire poison. Qing Hao is interesting because the same mechanism that works for malaria also works for cancer cells, is that cancer cells tend to be very iron rich, and malarial parasites are also very iron rich. and the Qinghao basically crosses into the cell and basically makes the cell explode. It's something to do with an oxygen reaction. I don't understand. My chemistry is really rubbish. But cancer cells do the same thing. And it also, because it's such a kind of radical explosion, it prevents resistance. So resistance in malaria is quite hard. It's resisting resistance, Qinghao, is a malaria remedy, but also for cancer. It's a wonderful herb. It goes into those deep levels of the body and clears heat. I use it for menopausal symptoms, for things like ME, for all kinds of different things. It's used for kind of summer heat ostensibly, but it's a herb that is another SHH. Yes. Yeah. Yes. It's been well researched for cancer.
I've got a question about the numbers.
Oh, those are grams. So that's the grams. Not homeopathic potency, don't worry. Don't start me on homeopathy. I'll get lynched. No, it's 30 grams. So it's 30 grams of Huangqi, 15 grams of Baiju, 15 grams of Lingjia. So it's a big formula, and it's a bit of a stonker. Go on.
So it was just a question on if people aren't absorbing very well, how...
Well, that's one of the things you try and do with the herbs. You try and help to, for example, strengthen the digestive system to promote absorption. Some cancer specialists use a lot of digestive tonics to strengthen the digestive system. That's one approach to use. And it's a good question, but you have to take that into account. And maybe use acupuncture also to help, with promoting digestion. What was the question there, lady at the back? Oh, okay, there's a few last herbs on the list. Hold on. Ooh, okay. So these ones here, this is interesting. This is Yuli Ren, Huoma Ren, and Chenpi. Chenpi, exactly the question that you asked. Chenpi helps to regulate the qi in the middle jiao, transforms dampness and alleviates bloating. Huoma Ren is cannabis seeds, the one that's good for moving the bowels. And cannabis oil is a really big treatment now and a lot of alternative treatment for people with cancer. And they use the ones with THC and they use the CBD one, which has got none of the mind-altering chemicals. But if you're interested in an interesting treatment for cancer, cannabis is an interesting way to go. I think there'll be a lot more research about that and hopefully some good research. And probably I'm going to start using it in my practice, although a lot of my patients use it. Do you use it?
Really quick. So are you making that massive full-on, you said some people would say it's too much because the guy's almost, it's so widespread, the cancer.
No, just because I wanted to have an effect. So actually, the treatment principles are relatively simple, but this guy is dying. We're trying to help him stay alive. So there's no messing around trying to do. Yeah.
He's dying, so you're throwing everything.
Yeah, I'm trying to really help as best I can, and this is the style that I use. I won't go into. That's a different lecture, but it's a different style. Let's carry on because otherwise we're going to run out of time, guys. So. Okay, as I said, the good result is that he's still alive, and he's stopped chemotherapy, actually. And he says if he starts, your question, I think someone asked a question there about whether he's decided he doesn't want any more chemotherapy, so he'd rather die than have more chemotherapy. I think if he starts to get abdominal pain and things like that, he might change his mind. And I'm supporting him to have chemotherapy, because I think in terms of my impact on him, probably 20%. Chemotherapy, I think, has been the thing, particularly the new MAB, that's really helped. And I've helped him to survive that. It's lovely. I love my relationship. I saw him the other day, and I haven't seen him for a few months. And he came in and he looked really well. And I said, my God, you look well. And I just said, you're still an ugly bastard. And I could see his face smile, because he's he liked that. He liked to be he's a soldier. He likes a bit of rough and tumble, and he swears at me all the time. And I love it. It's great. Proper relationship. Like my wife. Okay, so page 4, post-treatment recovery. Now, this is really important. Often people have treatment, okay, and then they're left? They're nothing. If you've had cancer and you've recovered from cancer, every ache and pain is a return of the cancer. Okay, every skin lesion, every bump, every whatever is the cancer coming back. And it's really scary, and I think there's a huge amount that you can do as acupuncturist, Stephen. A huge amount you can do to support them in their treatment recovery. So you can help to alleviate some of the side effects from the treatment, but you can also help with the ongoing benefits, and you can also relief over prevention. This is probably more immediately after the treatment. So when they finish chemotherapy, we're not talking longer term, we'll come on to that in a minute, but this is when they've recovered from treatment. Some of the benefits, for example, from herbs, radiotherapy continues to work 6 to 8 weeks after the person's had the radiotherapy. So it's really important that you continue to get the circulation going around that time to allow those free radicals to kill the cancer cells. And this is an example here of, she's a tough old bird, this one. She's a 63-year-old woman with throat cancer. She's had breast cancer she's had breast cancer after this, actually. Throat cancer, she's had radiotherapy, she's got burns on the skin over the site, severe mouth ulcers. So radiotherapy in Chinese medicine is hot, damages the yin, creates fire toxin, and can scatter the qi. It's one of those treatments which looks innocuous and relatively minor, but often it really, I think it has a very powerful effect on scattering a person's qi. So it really knocks them for six. Her tongue is swollen, dark red. She's got a lot of heat, yellow fur, and slippery and rapid pulse. And the treatment principle for her, predominantly herbal, was to clear fire toxins, to nourish the yin and the qi, and to move the blood. This is to help alleviate the side effects from the radiotherapy and to enhance the effectiveness. And the herbs that we used, again, I won't bore you too much with the details, but these are herbs to nourish the yin, to clear heat, and the second batch of herbs there are more to nourish the qi and the yin. And Zusao, someone told me they went to a moxibustion, a Japanese moxibustion, they were using Zusao lithosperma, it's the old name for it, as an oil. It's good for burns. And we used a Zusao Shui Gao, which is a cream to help to heal the burns on her neck. And she did really well. And we also did some acupuncture, God forbid. So this is the time where we open up Renmai, so lung 7, kidney 6 to nourish the yin, large intestine 11 to clear heat, stomach 36 to support the zheng qi, stomach 44 to clear heat from the stomach meridian and from the body generally, and colon 4 for affecting that, moving the qi in that neck of the woods, and spleen 6, because it's just good for everything, spleen 6. If you get stuck, just use spleen 6 in my experience. And she's still going strong. She was given a 10% chance of surviving. I think it was a year or 2 years, and this was about 6-7 years ago. So much so that she's actually had another cancer since then, and she survived that as well. She's a toughie, and she responds well to herbs. She contacts me now occasionally, says, can I just give her a repeat prescription? And she takes a repeat prescription, but she's well past the 5-year mark, and she's not one of the 10. She's one of the 10%, and she's still going strong. So again, I think that's she's a strong constitution, but she responded well to Chinese medicine and to herbs and to acupuncture.
Do you think it makes a difference how soon they see you after their...
Yes, I mean, I like to see people before, during, and after if I can. If I see them during, yes, but yes, as soon as you can see them, the better, basically. You don't want to see them, if it's all kind of settling down. Well, this is what we're going to talk about. This is number 5, the 5th stage, which is maintaining good health. This is what I was kind of getting a bit excited about before, but slightly got ahead of myself. Maintaining good health with these people who've been discharged, so they've got no treatment. Danny?
Are you going to talk about distal neuropathy?
No. No, what, from chemotherapy?
Yeah, getting it better.
Well, again, acupuncture, do you have experience with that?
Some.
Good experience with acupuncture?
Not necessarily.
Okay.
A bit more with Moxa, but,
Okay, I mean, some of the drugs, particularly the Taxols and Taxotere, those kind of things can cause a very bad neuropathy, which can last for a long time and sometimes can cause permanent nerve damage. Some of these treatments cause permanent damage, the chemotherapy and the radiotherapy. I've got a woman who's got fibrotic changes in her lungs after having radiotherapy for breast cancer, damaged the heart. Some of these treatments, the peripheral neuropathy is quite a common one. There are herbs that are used for that, and also you can use acupuncture. My experience is probably fairly similar to Danny's, is it's not a quick fix. It's not an easy treatment. There's been some serious neurological damage, and I think you can help, but it's not an easy treatment. Has anyone else got any? Go on.
Kiko Matsumoto, if you read some of her stuff, she treats peripheral neuropathy.
Okay. Kiko Matsumoto.
So if you read her books or journals with her details in it, they've had very, very powerful treatment.
Okay, this is good. So this is what we need to do as a profession. We need to come together. We need to start pooling our resources and experience. This is how we get stronger as a profession. But and it's really good if these treatments work and we can reproduce them. It's really good. So in this phase here, it's really important that you support the zheng qi, the upright qi. You help the person to find their path. Often people you know, if someone's developed cancer, the last thing you want them to do, in most cases, or many cases, is go back to exactly the lifestyle that they led before. This is a time for change. I've got one patient at the moment, she's a really sweet woman. She's 39 years old. She's got stage 4 breast cancer all over the place. She's had a very tough chemotherapy regime. She's taken herbs throughout. She's had neuropathy. She's had all kinds of terrible conditions. She's really depressed. They've just taken her off the chemotherapy because she's actually got no signs of any cancer anymore, which I think is a better result than they're expecting. The consultant always talks about her brilliant response, which I think is in part due to what we've been doing. So they've stopped her on the chemotherapy, but now she's got what? So my treatment for her at the moment is to tell her to email me some short, medium, and long-term life objectives. Because she's been on her own, she's been in her room, in her parents' house, she's lost her job, she's lost her friends. She's really in a very despairing state, and I just think she needs to kind of get going. I can't see her for acupuncture because she lives far away, but she needs to kind of start developing her path in life. And if you get a chance to read that Radical Remission book, some of the most interesting cases are when people said, actually, you know what, I was on the wrong path, this is what I want to do with my life now. And that galvanizes you, that gives you energy and vitality. That's better than Stomach 36 or even Chinese herbs. That kind of sense of waking up thinking, this is what I'm supposed to do, this is my Ming, this is my destiny. Really important if you can do that, and that's through discussion, that's not through herbs or acupuncture. So helping people to find their path is really important, and then addressing current health problems. So this is another case here. This is the woman with endometrial cancer who was supposed to die but didn't. She responded really well to chemotherapy. The tumours disappeared. It's now, I wrote this case is a year or so. I think she's about 4.5 years post-diagnosis now. She does lots of Qigong. She's changed her working habits. She's staying balanced. She can get stressed, but she's alive and she's cancer-free. It's a bloody miracle. It's a really good result for stage 4 endometrial cancer. It's a very good result, this. And again, I'm piecing that puzzle. All the other things she does are really important as well. Chemotherapy was really important. I think without chemotherapy, she would have died, but she did extraordinarily well with the chemotherapy, much better than they expected, and she stayed well, despite the fact it was very widespread cancer. And she can still, but now she gets stressed, she gets abdominal discomfort. As soon as she gets discomfort, she thinks she's getting the cancer back. She gets disturbed sleep, she has bowels, which can be loose. She's got signs of liver qi stagnation. And this is the kind of treatment that we do to help her. So we regulate the qi, soften and harmonize the liver, move the blood, and we nourish the qi and the yin and calm the shen. So with her, it's about regulating and nourishing the qi, and this is the formula that we use here with herbal medicine. There are some herbs that are, this is more of a kind of, to move the qi, to move the blood, to strengthen the middle jiao, and to nourish the qi and the yin, and to calm the mind. And these are the acupuncture points that I would use for her. So I might use Stomach 36 on one side and Gallbladder 34 on the other. It's my concession to 5 elements to balance wood and earth, and that's as far as I'm going to go. Okay, so I use wood on one side, earth on the other. Spleen 9, spleen 6 to drain dampness and also to help strengthen the middle jiao. Large intestine 11, you know these points very well. So again, all I would say is that these basic points here can be really effective.
Andrew,
Yep.
what are your views on patients having regular tumour markers? I have some who have them regular and some who don't. One thing that I will say to you again is you take your cue from the patient. That's about listening. So if they want tumour markers, they get tumour markers. If they don't want tumour markers, don't. You know, there's a very interesting study in terms of, this is many, many years ago study, and I haven't seen it reproduced. It was at the Royal Marsden, a guy called Stephen Greer. And he looked at different ways of dealing with cancer, with people with active cancer. And he did a spectrum between those who, the fighters, the ones who, right, I'm going to battle this cancer, all the way through to the complete deniers. Yeah, I haven't got cancer, I'm fine. And he found 2 groups did better than the other groups. The fighters and the complete deniers. Okay, some people don't. My own father was diagnosed with cancer, poor fellow, and he was given a year to live. And we said to my mum, we've got to tell him, give him a chance to, she said, if you tell him, you kill him. Okay, and we didn't tell him. He thought he was fine and lived for another 5 or 6 years. And I had probably the best time of his life, actually, in many ways. And I think that if we had told him, my mum was very wise, we would have actually finished him off, because it's like, he thought he was fine. How are you? I'm fine. And don't break that. So if they want to know, many patients send me their test results. They don't look at them. They don't want to know about those things there. So I think you have to take the cue. Other people want forensic detail. There are various blood tests which I'm slightly more skeptical of, the Greek tests, where you send blood samples off to Greece and they do these tumour markers. I'm not sure how valid they are. I need to research that a little bit more. But the main cancer tumour markers, I mean, things like PSA for prostate, there's some of the CEA markers for various cancers, CA19, whatever. I think they're quite useful because they guide, for me, I like them because it means that we can see if the treatment's going well. You know, if the PSA is going down, that's a good result. You know, that's what you want.
Also, sometimes they can rise because the kidneys are under pressure from cleaning out toxins and they can cause inflammation.
Yes.
So there's a balance with that.
Okay.
Oh my God, it's bad.
So but you look at a trend then. If it goes up and then it goes down, you know that there's something good going on. Okay, but that's, okay, so we're almost there, guys. Well done. This is living with cancer. This is for people who aren't cured, who have got cancer and it's ongoing. Okay, and this is a time for them for deep reflection or not. Sometimes they don't want to think about it, and you've got to take your cue from them. Okay, that's really important. You don't impose your own value system onto these people. Listen to what they want to do. I've got some very funny stories about these things here, which are, you know, funny stories. But sometimes they want to reflect and they want to change the way they live their life, but you take your lead from the patient. And remember, you're a piece in their puzzle. It's not just on your shoulders. Do what you can do. Don't be intimidated. Don't be scared. Do the best you can, and you'll learn through the process and you'll help the person as well. Treat symptoms as they arise, and balance between, I would say, targeting the cancer and supporting the Zheng Qi. Cancer can, and this is what's good about these books, and cancer can be definitely controlled, in my experience, with herbs and with acupuncture. It might not be able to eliminate it, but tumours can be encapsulated, for example, and they become, I've got a woman with thyroid cancer, and she hasn't had the conventional treatment despite me begging her to do so because it's quite a good treatment for it, but the tumour's become encapsulated and hasn't grown, so it's become stable in that way, and that's a valid treatment, basically, and she's kind of happy with that result. So with this guy here, this is a really lovely bloke. He grew up with Ezra Pound, not Ezra Pound. He worked in, his dad was a literary guy, and Ezra Pound used to come to his house on a regular basis, who was a good racist poet, but never mind. But a good poet. And this guy has got bilateral kidney cancer. He's been sent home. They don't want to do any surgery on him. He's basically said there's nothing they can do. So they don't want to give him treatment. They don't want to give him radio. They don't want to keep him. He's basically been sent home to die, basically. He doesn't want to just go home and die. He wants to kind of do something about it. He's got narcolepsy as well, which is quite interesting. He's never fallen asleep on me, but he regularly falls asleep on his dinner and various other things like that. He's got raised creatine levels, which is because of his kidney cancer. His tongue swollen, deep central crack, sticky yellow fur, red sides and tip. And he presented with really bad hematuria. So he's peeing blood, bright red blood, which is quite alarming. And again, there's nothing that they can do. They don't want to do anything conventionally. So he thinks this is the end. I gave him herbs. I didn't give him acupuncture to cool the blood, move the blood, stop bleeding, to clear heat and drain damp, and to support the qi and the kidneys. And interestingly, for the herbalists amongst you, I gave dried herbs. I gave Avicenna herbs, which are the pre-cooked herbs, the decoctions, very expensive herbs for him. And he didn't get anywhere with them. He didn't stop the bleeding. And I switched, to my horror, to the granules, and the bleeding stopped. Whoopsie. Oh, my goodness. Hold on, steady on. This is the formula. And again, big herbs. These are herbs. Sanqi, again, that magic herb that moves the blood and stops bleeding. Pu Huang is the bulrush. And then these are various thistles. And Shan He Tao is a fantastic herb. It's agrimony. You see it growing in the countryside in England quite a lot. I don't know if it's the same species, but it's the same genus anyway. Herbs to clear fire poison, again, dandelions in there, to drain damp, and herbs to support the qi. Huang Qi Dang Gui, remember I talked about that combination there. Qing Hao, the Artemisia plant that's good for cancer. And his bleeding stopped, okay, and his cancer has remained stable. And I treated him for a year or 2 years. And I gave a talk like this in Israel last year, and inevitably when you write a case up, they usually phone you up the week before you present and saying, I'm dying, so you can't talk with, so of course this happened with him. He phoned me up or emailed me and said, I'm dying. And I didn't think he was. I thought he had a urinary tract infection, and in fact, he did have a urinary tract infection, and he got some antibiotics for that because I wasn't seeing him. I would have given him herbs, but he wanted the antibiotics, and he came through it, and he's fine. So again, I think if he hadn't have had the herbs, he would have pegged it, and he's still going strong as far as I know. So almost there, guys. So palliative care. This is the really sad, difficult, I think, part of treatment here. When someone is, you know that they're going to die, and it's really difficult, and you've obviously often formed a really strong attachment to this person, and it's heart-rending. It's a heart-rending experience. I remember the first one of my patients that died, and actually the receptionist rather stupidly, actually it wasn't for this, she had scleroderma, but I remember my first patient when he died, she said, this patient's died, and I felt someone had actually, oops, sorry, someone had actually punched me in the chest. It's really difficult. And I've become a calloused monster since then. I'm much more kind of, I'm able to deal with it and cope with it much better. But it is tough when you see people that you really like deteriorating and becoming ill and then not turning up for treatments. That's often what happens. You don't, and then you get a letter from their relatives saying that they died or whatever. And it's really sad and it's bloody difficult, but it's also incredibly special. And I know it's a cliche, but it is the privilege of being with someone at that key moment in their life. You see incredible qualities of people, and you find qualities in yourself that things you didn't think you could cope with, you can actually cope with everything. Yeah? And so the key thing, I think, is this thing about being present, just being there, taking your lead from the patient. Sometimes they want to talk about it, sometimes they don't want to talk about it. They want to talk about football. I try and discourage them from doing that. I talk about rugby, but I don't talk about football. You can help to alleviate some of the symptoms that they're experiencing, whether it's pain or insomnia. You can support the qi, you can calm the shen. You can do lots of things, and I think there's a whole school. I don't work in hospices, but I think there's a lot of acupuncturists who do extraordinarily good work in hospices, and I think that's a really worthy thing to do, again, because it's just, you're helping people to make that transition, you're giving them comfort, you're giving them solace to their spirit, and you're helping them feel better as well. So this guy here, really, again, a really nice bloke. He's a 58-year-old man with esophageal cancer. It's a real bugger of a cancer. He's had surgery, he's had radiotherapy, they've cut his stomach out and put his esophagus out and put his stomach up here, and he's had a terrible time, and he's really had enough. So he's got dysphagia, fatigue, nausea, vomiting. He's got secondary cancers in the brain, lymph nodes and abdomen, and he's just decided that he's had enough, basically. So my treatment for him was to support the qi in the blood, to regulate the middle jiao, or what's left of his middle jiao, to help his digestion, and to carry on. I'm a perennial optimist. I still think that miracles can happen, and sometimes they do happen, and the longer I go on, the more I see miracles, which is great. And that's an interesting question about what you tell your patients, your question there. Do you say, if you say you can't cure cancer, are you just then reinforcing the fact that you're not going to do anything? It's a really difficult balance. And my feeling is that I give them that Kelly Turner book and I say, look, anything is possible. I'll support you in that process as best as I can. These things, miracles can happen. Believe in miracles. But keep your feet on the ground and don't overpromise. Don't promise too much because that's unfair, basically. Do what you can. So with him, he had, again, I apologize. That's all I can say about my acupuncture. I apologize, because it's fairly similar treatment. So spleen 6, Ren 6, trying to get the qi going down in the middle jiao so that things are moving down rather than the qi rebelling upwards. Pericardium 6, again, to calm the mind, but also to regulate the stomach. Yin Tang do 20. Embarrassing. Okay, and these are the herbs that I gave him here again. So for the herbalist amongst you, we're nourishing the qi, we're nourishing the jing, and we're also doing some herbs in the middle, Chen Pi Sha and Ho Po, to help to regulate the qi in the middle jiao. And we're using herbs like Sanqi Rushang is a frankincense, remember I told you it's good for secondaries in the brain. And then we're doing some anti-cancer herbs here, but not such big dosages. And I think he was constipated when I wrote this. This is rhubarb root, Da Huang, which helps to move the bowels. So again, we helped him, but he did die, and he died very bravely and very well, and it was good. Now, before we do that, there is an 8th stage to your treatment, and this is, in a way, this is up to you. But I don't know what you guys think, and I think this is up to everyone to have their own system of belief, but I don't think that consciousness finishes when the body dies, and probably most of you think probably fairly similar things to that. And I do think that you have a connection with your patient, of Shen to Shen, whatever you want to call it. And I do think it's really important to think about your patients and to send them good vibes when and if they die or if they're dying. You can do it with meditation, you can do some kind of 8th stage in a way, which is helping that person make that transition. Obviously that's for each person to do in whatever way they want to do it. But I think there's a value to that, and I think my feeling is it helps the person make that transition to wherever it is they're going to trundle off to. So we come to the end almost. I haven't finished with you. I think it's difficult to find a really cheery quote after a talk like this, but the best one I found is the one from Jung, which he says, "I'm not what has happened to me, I'm what I choose to become." And I think that's really important. I think although people obviously haven't chosen to develop cancer, might feel that their life has been taken away from them, they have choices about how they live their life and what they do in their life and how they respond to this terrible kind of crisis. And some people rise majestically to the challenge, other people, don't and become very fearful, and you have to support each person in whichever way that you can. So just to conclude, thanks to my patients teaching me about Chinese medicine, and just a quick advert about the White Crane Academy Chinese Medicine course, which you're all going to sign up to now. If you're interested in herbs, come and talk to me. Has anyone got any questions at all? Anything else apart from what we talked about? Go on.
I was just wondering, obviously, cancer among adults is unfortunately quite widespread, but it's very rare in young children. Is there much experience and wisdom out there around pediatric cancer?
I treat children, and I've had mixed experiences of treating children. I have treated children who've done really well, actually. Again, I thought they died, and I found out they were still alive like 7 or 8 years later, because they were a child with I can't remember exactly, but it was some kind of brain tumour, and they weren't expected to live. And we had to smuggle the herbs into the hospital, and they administered the herbs via a nasogastric tube to this child. And so the parents were really committed. They didn't, it was difficult. This is whether you tell your oncologist or not, but this is what they chose to do, and the child did really well. I've had other children. I've had a couple of kids who've died. I think it's treating children is a whole discipline in itself. I have limited experience, but I have some positive experience, and I won't shy away from treating kids. I don't give young kids acupuncture personally, but you can obviously if that's what you do. But it's definitely worthwhile treating if the parents obviously are open. If you can involve the oncologist, that's fine, but my experience is they tend to knock everything on the head, and then it becomes a real conflict between the patients and the oncologist and you, and it's not a happy situation. Often what happens is the oncologist just wants, many times the oncologist, particularly with herbs, I think they're probably okay with acupuncture, because acupuncture is one thing, but with herbs, oncologists often want to know what the herbs you're giving them. So I write them a long list in pinyin, give it to the oncologist, and they're none the wiser, but they feel that they're in control. And so they're happy with that. But children, definitely worthwhile treating. I started off years ago. I used to experiment. I used the decoctions, so you boil up the herbs. And in Avicenna Clinic, where I used to work, we have a very nice way of doing it. So we cook up the herbs for the patient and we give them a sachet. But it costs £100 a week. And in fact, I actually left Avicenna because I had an argument about a patient who I gave powder to because she couldn't afford £100 a week. These granules cost about £30, £35 a week, which is still expensive. I use Donica, which are available over there. And I find them to be really good and consistently effective. 20 years ago, I did some experiments, and I treated people with what were the powders, and then I compared the treatment with the active herbs. And I didn't use the powders for another 20 years because they were rubbish. It didn't work. Now, I think I'm getting the best results of my life using the granules, although I still reserve the right for some patients to use the decoctions. But I think the granules are good enough now to get a really good treatment effect. And we're talking about measurable effects, whether it's biomarkers, bacterial infections, all kinds of things, and quite serious diseases. So I'm really happy with them. This is a daily dose. I give a stonker of a dose. There's a big variation in that. Some people give tiny dosages. I think big dosages for me are ones which are more effective. You give the smallest necessary dose. If that's 400 grams a day, then that's what you have to give. Anyone else got any questions? Oh, you're careful. It's like bidding at an auction here. Put your arm up. You have to ask a question. Anyone else?
Someone's got like kidney tumours and metastases on the liver, and you're giving big doses of Chinese herbs. What tells you that it's the herbs that they're reacting to? Is there anything?
I do liver and kidney function tests. Yeah, most people, for example, having chemo will have regular blood tests where they do liver and chemo. I've got one of those little Reflexon machines, so I can do on-site blood testing if I need to. Or if I'm concerned then I get the patient, if I don't have access to that, for example, if I'm in Brighton where I work, I get them to get a blood test from their oncologist or from their GP and to see what happens. You do have to take risks, but my experience again is these herbs are are well tolerated. If it's too strong, if the herbs are too strong, you reduce the dose. If it still stays too strong, you take the herbs after food, not before food. You give the minimum dose that you can do, and if they can tolerate the full Monty, then great. If you have to reduce it, then that's fine as well.
So what's the maximum dose you'll give?
I don't have a maximum dose. So the minimum necessary dose, if that's 1,000 grams of a herb, that's fine. I'm giving patients, several hundred grams a day for acute urinary tract infections, for example, and this is people taking it for a long time. I think herbs are generally well tolerated by people. They can get digestive problems, but often they get used to them. So there's no maximum dose. I know a guy in America, Isaac Cohen, who's written about breast cancer quite soon. He does 500 grams. Thank you. 500 grams a day of one herb. Baihuo should have 500 grams, so there's no rules. Hold on, anyone else?
Can I just flag up for those acupuncturists who don't and can't use herbs?
No such thing.
That Martin Powell is doing a mushrooms day on the 4th of November.
Okay, those are the medicinal mushrooms, the Lingzhi, the Ganoderma. It's as a supplement, it's worthwhile. It's got some good research. Martin Powell's a good bloke and he's a good product. Again, it's a halfway house. If you want to use, it's a herb, but if you want to use herbs properly, do a good training. I don't mind where you train. Obviously, I like you to train with me, but I encourage you, particularly those with full of vigor and vim and who don't mind doing some hard work. I really encourage you to consider doing herbal medicine training. I don't care whether you train with me, but it's just a fantastic, not just an adjunct. It's yin and yang. Okay, your acupuncture is yang. You get things moving. Herbs are yin. You don't just work with yang, you work with both. And I think you get considerably better treatment results if you can combine the two. You're full of questions, you are, aren't you? You're going to have to do it. Twice a day, but sometimes more if necessary. For acute UTIs, for example, up to 4 times a day, but most people it's twice a day. Any other questions?
It overlaps, so it might be a bit of repetition, sorry. If you've got somebody with liver mets, and obviously the liver, I'm assuming, but again, could be wrong, is processing some of these herbs.
Yes.
So would you start with a more cautious dose?
Yes, if I've got someone who's got very raised liver enzymes, and they've got, but not just liver met, sometimes you start maybe cautiously, you don't necessarily go into, but you've got to kind of balance between, you haven't got that long to get an effect. So I would use, herbs like hujiang, shakutsao, 12 to 15 grams of those, baihuo shishidzao, 30 grams, fairly robust dosages because I think that they're generally quite well tolerated. Any other questions? Okay, thank you very much. Great stuff, thank you. I'll leave it up.